A hearty good afternoon and welcome to the session on indications for IVF. We are glad to have Dr. Janani Iyer among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Hi, good afternoon, and thank you for welcoming me here in the session. Today I'll be talking about some of the indications for IVF, and I do welcome your concerns as and when, and I'll pick up the questions as it comes to me. So to begin with, now world over, it is majority of the people do know about IVF, and it is a gold standard when it comes to fertility treatment. However, it is very important to know whether one is really an eligible couple for IVF or not. IVF, for in vitro fertilization, stands for the gold standard for assisted reproductive techniques. It's for couples who wish to have a child and who've been trying and not able to have that naturally. Now, this is where I think we all need a little bit of clarity to say when is a couple really eligible for an IVF treatment. Now, when you look at the background incidence of subfertility, we see that 1 in 5 couples who come and who wish to conceive, they do face fertility issues. Now, when we see couples for fertility, we have to assess both the man and the women, and this is where everything starts from the beginning. That is, from the age to the duration for which they have been trying to conceive. And when this is taken into consideration, it is important to first say that since how long a couple has been trying. So uh, when we take this into consideration along with the age, if you have a couple who are less than 35, then all being normal, that is regular cycles, we would then say that okay, you can actually try for 2 years. The average, the percentage conception for a couple every month is about 30%. So if we have 10 couples under the age of 35, then you can expect that in a year, about 8 out of them, 10 will conceive. And then in the leftovers, too, even one more will conceive for trying out for up to 2 years. So after 2 years, we have very few couples that have been left without achieving a pregnancy. So that's when we say that sometimes time is very important. And when I say time, patience is also required. So in our Indian society, where we do see that a lot of cultural issues exist and there is a lot of pressure on couples to have a child, which is when we see that it will probably be only 1 or 2 months, or even they have been married and they are already coming to say, look, I really want to have a child in the immediate future. So when that's the case, it is important to understand basic physiology to say a woman releases only one egg every 30 days, which is in one menstrual cycle. And therefore, it is the job of the sperm to actually fertilize that egg. So when you get only one chance every month, we can understand that why time is important and you have to be really patient. And all this can be said, however, only when we know that everything else has been normal. So we need regular menstrual cycles for a lady, because that itself is suggestive that ovulation is happening. And when that egg travels, it has to travel through the tube. So the second thing is the tube that we look into. And then the third thing is there has to be enough sperm numbers. So that is the sperm factor that we are looking at. So like when we have to standardize, when we have a couple who is coming and expressing their concerns, the first thing that we will be looking for is whether the lady is ovulating regularly or not, and whether they are able to have intercourse regularly without any problems. Is there pain, frequency of intercourse, all those matters. So then when we are looking at problems with regards to fertility, we are then able to divide it into several categories and see if a couple is actually coming into a certain category, and then decide whether they need IVF or there are other treatment options that we can give them. So when we consider all this, so you can divide subfertility as per causes. Once we look at female factors. So in female factors, as I said, when you look at menstrual irregularities, that can become a cause. That is, and that's when PCOS comes into play. So PCOS is a very, very important cause and a very common cause, because in this, primarily what we do not get is regular eggs out of the ovary, which is anovulation, and that is one important factor that we have to consider. Now, if there is polycystic ovaries, IVF doesn't necessarily is the first treatment option. The first treatment option is to regularize the cycles, which is to help in giving ovulatory cycles. And then next, when we go to other female factors, is when you have to look at tubal factors. So as I said, the egg has to travel through the tube. So if there are any tubal factors, which is past history of, say, an ectopic pregnancy, or any history to say there has been tuberculosis in the past, or other causes, which will be pelvic inflammatory diseases, anything that makes you suspect that, look, the tubes could be problematic in this case, then we must understand is that if the tube is not normal or is it diseased, it is highly unlikely that it is going to help in the transfer of the egg. And if that's the case, if the tube is blocked, then obviously it means that the egg is not going to be able to reach the sperm, and vice versa. And therefore, that becomes an important factor that we have to consider. And yes, there are tubal surgery options available. But if that is something that doesn't, happen for the couple, and they are not able to afford, or it doesn't work for them, then yes, tubal factor and problems with tubal factor is an indication for IVF. Then the other factors, see, you have to look at tuboperitoneal relationship. That is, the uterus tubes and ovaries, they are in a particular anatomy. That is, they are placed in a certain manner inside the abdominal cavity, and therefore factors which can disturb this anatomy, therefore might will obviously can cause problems in fertilization process. That is, the egg and the sperm may not be in a position to come together, and such factors therefore include endometriosis. Then they can also include the same pelvic inflammatory diseases. The other reason for all this is presence of fibroids. Now, again, presence of fibroids in the uterus merely does not mean that conception could be a problem, but of course it has to be in a, if it is in a position which is hampering the embryo to sit inside, say, for instance, where an embryo should be implanting, if there is a big fibroid inside, then we know that this could be a deterrent. Also, when we talk about fibroids, usually we have to look at other factors, and in absence of other factors being a problem, you would then say, okay, we've tried for so long, it is not happening. And depending upon where the fibroid is placed and how big the fibroid is, one may advise that removal of this fibroid, and if that's also not worked, then of course IVF is advised. So when we look at female factors, all this only contributes for about 25% of the actual reasons why subfertility exists. Then the other 25% can be contributed, is sometimes due to male factor. So male factor is where we talk about sperms and problems. So when we talk about sperms and problems related to that, it can be anything from the count of the sperms to the fast forward swimming sperms, that is the motility of the sperms. And the third thing we are looking at is the ability of the normal sperms, or the morphology of these sperms. Now, all these three factors is very, very important. And when one is less than the other, so for instance, one criteria is missing, motility and the normal appearance sperms is good, then we would count it as mild male factor. However, more than one parameter is not up to mark, then even though we may try IUI, it may be that we have to then resort to IVF. Similarly, if all the parameters are quite bad, or in certain cases where there is no sperm, or what we say azoospermia exists, or where it is the form where it is called obstructive azoospermia, that is, the testis is able to make the sperms, the sperms are just not coming into the semen, then these are the other cases where IVF or ICSI is actually advised. So we have male factor problems, we have female factor, and in another 25% we have where we will say both are implicated. There is a combination of both female factor and male factor. So, for instance, we can simply be put that the sperm is not great quality, and at the same time there is something in the female as well which is causing a problems. Now together they constitute another 25%. And in such cases where there may be, like, if you have polycystic ovaries, then you can correct it and then plan it with an IUI at the same time. But again, if these don't work, then you have to shift to IVF. The fourth category is where you have no problems at all. That is, the couple have been trying, you haven't figured out, or you are not, everything, the random tests that you do are all completely normal. Then, just because of the length of time, that is, if somebody has been trying for more than 2 years and everything is normal, then the chances of conception per month reduces to just 3%. Then you have to think and say, look, I'm not able to find a actual cause for this. Then it is likely that we will then shift focus and say, okay, let's look at what is going to be the solution. And that's where we, in unexplained subfertility, we would say, okay, let's just try and do IUI. And you can go up to maximum of 6 IUI cycles, wherein you will time the ovulation and you will put the sperm at the right time to say if that's helpful for the couple to get pregnant in an unexplained subfertility case. And beyond that, if that is not happening, then this is another case where you have to say, okay, this is not working, we have to step it up, and then you go for IVF. So again, we find that we get a lot of combination patients who require IVF. So, and in IVF, again, there are so many modalities where we are able to help couples. And also, IVF is where you get to know what is the problem. Say, for instance, when we have polycystic ovaries and you have a lady who's ovulating, and you have been able to get that by giving her ovulation inducing agents. Commonly, we have clomiphene, we have letrozole, and we are able to give that. And we have tried, we have corrected a problem, and then you try and see if you are able to get the couple to conceive. But often, what we we miss is that even though these couples, when they are not actually conceiving, then we have to think about greater factors. That is, we do know that in polycystic ovarian syndrome, the egg quality also plays a big role. So again, just seeing that an egg is rupturing, a follicle is rupturing and can they sometimes not be adequate because the quality of the egg may not be great. And it is known that women with polycystic ovaries often do face these kind of issues. And that is when you do an IVF for these women, it is when, depending upon the quality of the eggs and the embryos that you get, you actually are able to then decipher that, okay, this has been the issue in this particular case. So that is one thing. Again, the other reason, the reason I'm coming back to female issues is because they do sometimes, it is we do see multifactorial problems in the same women. So we do see an overlap of polycystic ovaries along with endometriosis. And again, these are couples who really do well when they resort to IVF. Yes, it is not that they cannot conceive with other ovulation induction and IUI, but IVF is, as I said, it is the final stage of treatment. So normally we would say, okay, try the other less invasive methodologies first. But beyond that, IVF, because you get more information of eggs, sperms, and embryos. And literally, when we do treatment options like IUI, what we are assuming, it's more on assumptions. That is, you've seen a rupturing follicle, so you assume that an egg is coming. Again, you assume that the egg is trying, assume that the sperm is going to be there because you put it at the right time, and then you just hope and pray that yes, it is going to click for you. Whereas when you do an IVF cycle, a lot more information is to light. As I said before, it is the kind of eggs that we get. Also, it tells us about fertilization potential of the sperm, and then you know whether you are getting a good quality embryo or not. Now, that's when the another indication for IVF is sometimes we do see couples who have had recurrent miscarriages, and we really don't know as to why this is happening. And it is not wrong to offer IVF to some of these couples, because again we often see that sometimes these women will probably just make a lot of abnormal embryos, and that is not worth putting back in an IVF cycle. So when you actually have done all the workup for a recurrent miscarriage, and that has been all normal, and then you try and do an IVF for such couples, you're able to select a normal embryo and put back. The majority of these couples do well, especially for those who have had recurrent miscarriages in the first 3 months of conceiving, and then not being able to carry that pregnancy on. These kind of women do very well with IVF cycles. The other thing about IVF indications that I would like to put forth is, sometimes we do have women again who are on the older age group, who are trying to get pregnant, and for them we if for whatever reason, if they've got married late and then they are coming to us. In those cases, because time is of essence, we all know that with age the egg quality does deteriorate. So it is basically that you have been given a set number of eggs, and those eggs are coming out every month. So as you get older, the number of eggs as well as the quality of eggs reduces, which interprets into a greater risk of miscarriage for an older women. And when we have such older women, then we'll say, okay, time is of essence. We trying to give them quite short time of, say, natural trying. And especially if they are 39, 38 to 40 years of age group, then we'll say, okay, if everything is normal, you can probably consider an IUI for 3 months or 4 months. But beyond that, if you're not successful, then we would advise such women to come through for IVF sooner rather than later, because we know that it's like you have to make hay while the sun shines, which is to say, make the most of the time that you have had, that you have. Therefore, sooner they resort to this, then the likelihood that they are likely to get better quality embryos, and therefore chance of conception will increase. Because one thing even IVF cannot change is the age. The older the age of the women, the chances that they will get a better quality embryo and the number of eggs that they would get decreases. And hence we have to be, that is, if somebody was to ask me what is the single most important thing that you would advise women out there about IVF is, IVF may not be for everybody, and it may not be required. But if you are somebody who's been trying definitely 2 years or more, then yes, seek help. That is one. Unless there is any history in the family, which is, say suppose there is a man, he's got a brother, the brother is also not able to conceive or anything like that, then obviously it suggests that you have to seek help sooner rather than later. But the most important thing is about a women's age. So older a woman is, the sooner they should seek help, which is why a cutoff of generally 35 years is kept, which means that anybody under than 35, all being well, you can wait up to 2 years. But then anybody over 35, we would normally say that max you can allow yourself to conceive naturally is about 1 year. But if and within that year, if you identify that there are actually issues which can make conception a problem, then it is better to address that. And again, therefore, resort, if you're being advised on IVF, then it is better that you resort to things sooner rather than later. The one more thing that I would like to actually speak about before finishing about indications of IVF is sometimes about low AMH. Now, what is AMH is, it's called anti-Mullerian hormone, and anti-Mullerian hormone usually it is a marker for the egg quantity, or the quantity of eggs that is there in the ovaries for at given point in time. And that is usually you would expect that a healthy young woman would have a normal AMH. But however, we do see that on many occasions there may be women who are very young but still come with a very low AMH. Now, low AMH is not necessarily an indication to go for IVF, because we do not know how many women are out there and who've got a low AMH but they have been able to conceive naturally. So if we do get low AMHs, then again, they should be still allowed to try naturally. And however, it is something that you should keep in mind. And if they are actually struggling, everything being normal, then they should be under the fertility specialist, so as to guide them. The only thing about AMH is, which is already known, is that if you have a low AMH, then your performance with an IVF cycle may not be great, especially with giving the number of eggs that you would like when you are going through an IVF cycle. Of course, logically, if you have more eggs, you can have more embryos, therefore more to choose. And that is the basic principle of doing IVF, that you get more chances when you get only one egg every month to see if you get spontaneously pregnant. IVF is more about chances. So if you get more embryos, you are able to get a better choice of which is the best embryo, and then that is being put back. So that is so low MHP women tend to get lower eggs, but however, again, even in those women, age is of great importance. If we have a younger woman who has got a low AMH, and if she gets a better embryo, if she gets a good embryo, then her chances are actually quite good compared to somebody who's got a low AMH and is about 35. Uh, and with this, I would like to conclude my session saying there are plenty of indications for IVF. However, at any given point in time, we have to know whether the indication is absolute or relative. That means, if suppose there is no sperm, then obviously it means that, okay, you've got to try and investigate as to what is the problem. If the sperm can be retrieved, then we know with zero sperm, natural conception is not possible, and therefore they have to go for IVF. So that is called an absolute indication, which means there is no other scope but to go for it. But majority of the other indications are relative indications, which means that you can try other things, but if that doesn't work, then you have to step it up and go for IVF treatment. With this, I'd like to thank Apollo Fertility for giving me this opportunity, and I will be happy to take any questions that come across. Thank you.